The debate, which will come to a close this week, has in one sense been going on for a year, but in another sense, it's been going on for a century. In 1912, Theodore Roosevelt campaigned on the promise of a national health insurance program. Workers, Theodore Roosevelt said, are entitled to a basic standard of protection from injury and illness. Quote, wherever such standards are not met by given establishments, by given industries, are unprovided for by a legislature, or are balked by unenlightened courts, the workers are in jeopardy. The progressive employer is penalized, and the community pays a heavy cost in lessened efficiency and in misery. Well, since Teddy Roosevelt said that, presidents and members of Congress from both parties, seeing the same costs that Theodore Roosevelt saw in the failure to assure health care for all, have grappled with this issue. These attempts at reform have largely fallen short. They've foundered for many reasons. Health care is personal and complex. The timing was wrong, or the politics were difficult. Leaders on all sides failed to find the compromises that would have enabled them to move forward. But the recurring theme is that time and time again, reformers have failed to overcome the enormous obstacles that those who profit from the status quo have been able to erect. And because we have fallen short in the past, Americans today face a health care system that costs too much and too often delivers too little. In our United States today, mothers and fathers wonder what else they can cut from the family budget to afford yet another increase in their health care premiums. Parents file for bankruptcy because their insurance fell thousands of dollars short of providing for a child's life-saving treatment. Nearly two-thirds of the bankruptcies in this country involve medical costs, and more than half of those involve people who had insurance. Small business owners eliminate health coverage for employees because they can't afford another year of massive premium increases. And thousands of Americans who woke up this morning with health care insurance will go to bed tonight without it. Despite those tragic facts, entrenched interests have sought again to prevent reform, to consign our nation to an unsustainable status quo because what's good for the American people will not necessarily profit some company. The health insurance industry has dominated health care decisions in this country for too long. How often have our constituents come to us with stories of insurance companies that deny them coverage of necessary treatments? How often have our constituents told us of insurance companies that deny coverage because of pre-existing conditions or canceled coverage because of minor inaccuracies that the company conveniently discovered just after diagnosis of a serious and costly illness? It is time to end the unhealthy dominance of the health insurance industry. And so I'll cast my vote again against those entrenched interests, and my vote will be for health care reform, and I hope our colleagues will do the same. We have the opportunity to finish the task of overcoming the entrenched opposition, to do what so many presidents and so many members of this body have fought for decades to accomplish. The months of debate have been difficult. They've too often been filled with too much heat and too little light, with exaggeration, with half-truth, with untruth, with innuendo, designed to obscure rather than to inform. That's no different in many ways from some previous debates on major reforms. When Congress approved Social Security in 1935, a Republican senator warned that it would, quote, end the progress of a great country. When Medicare was debated in 1965, one critic charged that cooperating with the plan would be, quote, complicity in evil. The scare tactics of the past were absurd then, but they worked. And now we get some more scare tactics. A number of our Republican colleagues continue to claim that this is a big government takeover of health care. Well, the American Medical Association supports this health care plan. Surely the American Medical Association is not a supporter of government takeover of health care. Then we're told that this will hurt Medicare, and yet the association that represents more seniors than any other, AARP, endorses this health care plan. So the scare tactics are coming at it again, but there's a difference. That while scare tactics were able to derail health care reform in the past, scare tactics are just not working this time. The American people have expressed their disapproval of wild, inaccurate claims in many ways, including personal conversations with most of us. It is true that because health care is so complex, because changes must be phased in and transition periods are often necessary, many of the benefits of this bill will not take effect for some time. But improvements in health care for millions of Americans will take place almost immediately. After President Obama signed this bill into law, small businesses immediately get a tax cut to help defray the costs of providing insurance to their employees. Within 3 months of the signing yesterday, the bill will allow people with pre-existing conditions to access a special fund to help cover the gap until insurance exchanges where they can obtain coverage become operational. And retiree health plans will qualify for a reinsurance program to help lower costs. In October, the federal government will begin helping states set up agencies to help consumers choose new health plans or to challenge unfair decisions by their current insurance plan. Eventually, those agencies will help consumers enroll in insurance exchanges that will help millions of people find dependable coverage that meets minimum quality standards at a price that they are more likely to afford. And within 6 months of the President's signature yesterday, insurance reforms will begin to take hold. New health plans will be required to let women see an OBGYN without seeking insurance company approval. They will be prohibited from denying coverage to children based on pre-existing conditions and required to allow children to remain on their parents' policies until age 26. They will have to, those insurance companies, to provide preventative care without co-pays or deductibles, and they will be barred from setting lifetime coverage limits. Those historic improvements in our health care system will take place, and they will take place within the first 6 months after enactment of this legislation. More sweeping changes will come with full implementation of this bill's provisions. We will protect Americans of all ages from denial of coverage based on pre-existing conditions, from annual limits on treatment, from exorbitant out-of-pocket costs, and from confusing and opaque language that disguises the cost or the scope of coverage. We will even require insurers to give their customers a rebate if those insurers don't spend enough of their revenue on patient care. And we will fill Medicare prescription drug donut hole that hurts so many seniors. So at its heart, Mr. President, this bill and its improvements in this reconciliation effort aims to tackle the central problems of our health care system, rising costs and the insecurity that many Americans rightly feel about the lack of dependability of their insurance. The cost of health care already exceeds the ability of many American families to pay. Will price more and more families out of the system if it continues to rise, and will present enormous problems for the federal budget if not contained. We can and we will make the health insurance system work for those who already have coverage by holding down those unsustainable increases in premiums. And in ways large and small, we attempt to tame this beast that threatens to swallow our family budgets and our federal budget. How are we going to do this? And I would ask the Chair, how many minutes do I have remaining?
The Senator has 5.5 minutes.
I thank the presiding officer. Even though health care experts believe that these measures are going to help lower costs for families and the government, the Congressional Budget Office, that is not even taking into account the savings which will come into exist by ending wasteful subsidies to insurance companies using Medicare Advantage, by requiring Medicare Advantage to spend at least 85% of revenue on benefits, and by other kinds of savings. Some of those savings cannot be figured out precisely by the Congressional Budget Office. And so they are prudent. They don't even take those savings into account. But what they do obviously take into account and do count are the reductions which will lead, the savings which will lead to $140 billion in savings for the federal budget in the first 10 years and $1 trillion over the next decade. Those savings are real savings. Those are savings which they can figure out and cost, and including we are going to subject investment income of the nation's wealthiest families with incomes over $250,000 to the Medicare tax. We're going to impose a moderate Medicare tax increase on those that have that kind of earned income, over $250,000. This bill cracks down on artificial financial structures, and I commend the Finance Committee for this, Senator Baucus and his colleagues. They are cracking down on artificial financial structures with no economic substance, whose only purpose is to allow their users to avoid taxes. The Finance Committee has struggled with that issue for years. They have been trying to do this for years. They have succeeded in doing this. And we pick up an awful lot of revenue that is owed to Uncle Sam by ending this kind of loophole which has allowed wealthy individuals to avoid paying taxes through the use of artificial financial structures that have no economic substance, whose only purpose is to avoid paying income taxes. And so, Mr. President, we'll take an enormous step with the passage of this reconciliation bill, joined with the bill which the President signed just yesterday. Leaders of our country, from Franklin Roosevelt to Harry Truman, Richard Nixon, Ted Kennedy, have fought so hard for these kind of reforms. We are finally going to provide health insurance to millions of Americans who do not now have it, and we're going to protect those workers which Teddy Roosevelt warned nearly 100 years ago were in jeopardy unless every American had health insurance. The opponents of reform are vocal, they're strident. We're going to hear amendment after amendment being offered in an attempt to derail this effort. I hope our colleagues will answer history's call and make real and lasting changes that these bills provide, and will improve the lives of our citizens in ways that we've been struggling to do in this Senate for decades and long before many of us got here. To those who continue to oppose reform, let me ask some questions. Isn't it long overdue to end discrimination based on pre-existing conditions? The American people believe we should, so do I. Isn't it long overdue, I ask, to end the insurance industry practice of rescissions, the denial of coverage to those who paid for it? Well, the American people believe that we should, and so do I. Shouldn't we do something about the thousands of Americans who are forced into bankruptcy because of health expenses, even though they have insurance that they thought would protect them? The American people believe that we should, and so do I. Shouldn't we take strong steps to rein in enormous, ever-growing health care expenses, expenses that threaten to put health care out of reach for more and more Americans and to bankrupt our nation? The American people believe we should, so do I. And shouldn't we clear the way for 32 million Americans who do not now have health insurance to obtain it? The American people believe we should, and so do I. So I hope we will join together this week and do what so many before us have tried and been unable to do, to reform a system that leaves so many of our fellow citizens in jeopardy. And I urge the approval of this bill, this essential reconciliation bill that has been passed by the House, as part of a package of historic legislation, and to finish the task of bringing landmark change to American health care.